everyone, my name is Gretchen Reynolds and I'm a clinical neuropsychologist at Brigham and Women's Hospital. Hope you're all doing well and staying safe during these times. And I'm looking forward to just speaking a little bit today to you about how to monitor memory changes as we get older and really to try to distinguish between what's normal forgetfulness and what's something that's maybe a little bit more serious that you might want to discuss with your doctor. So some questions that might be helpful to ask are, number one, has there been a change in your memory? Right? So when did it start? Is it consistent? Does it feel different from your baseline? Because of course memory changes as we get older, but we want to think about, for you, what does this change feel like? Another question that can be helpful is to think about, is your memory similar to people of your own age group, so your peers, right? So it's really common as we get older for it to take maybe a little bit longer for us to retrieve a name, right? But it would be less common to forget the names of close family members or friends. So it can be helpful to think about, how does your memory, in your opinion, kind of stack up to your peers? Number three, it can be really helpful to talk to family or friends, right? And so asking them, have they noticed a change? Have they expressed concerns to you? Things that might be a little bit more concerning, or something like repeating yourself within the same conversation that maybe you don't notice, but your family does. So it can be really helpful to get that extra perspective. And in the clinic, we always try to recommend, or at least speak with, a family member or friend to have that dual perspective. And then number four, this question is really important. Thinking about, are your memory problems or difficulties with thinking, are they interfering with your daily functioning, right? So are they getting in the way of things like paying your bills, or remembering to take your medications, remembering your doctor's appointments, driving, cooking, all these day-to-day things? Is it kind of getting in the way with some of these activities now? That would absolutely be a time to discuss that with your doctor. And maybe it's not that you're making errors, but maybe you're having to use a lot more strategies to get those tasks done. So those are questions to really think about as you're noticing memory changes. And in order to do this, you can think about what we like to talk about as being a curious observer, right? So trying to get to know what your memory looks like. So monitoring is a really powerful skill that we can try to do a little bit in our daily lives. It's not something we necessarily tend to do, right? We're often so busy. But it can really be helpful to try to get a better picture by just becoming a better monitor of our daily memory. To do that, or to help, especially when you might go in to see your doctor, you could think about keeping a list or a record of any memory troubles that you might have, because then you can better discuss those in detail in the clinic. And the last thing I'll say is kind of one framework where you can monitor memory or kind of break it down is to think about it in 3 stages. So when we test memory in the clinic, we think about 3 stages: learning, storage, and retrieval, right? And memory can kind of break down at any one of those points. So for you, it can be helpful to think about what aspects are hardest for you, right? So we all have this experience of walking into the kitchen or forgetting why we went there, forgetting what we're doing, right? Or maybe I just forget the name of someone that I just met. Really common experiences, but some of them might be a little bit more attention related, right? They might be on the front end side of things, that maybe it's not I forgot the name, right? Maybe it's just I never learned it to begin with because 5 people were talking at me and I didn't quite catch it, right? So that's maybe less of a memory problem and maybe more related to attention, or the front end side of things. Or maybe I kind of absent-mindedly walked into the kitchen, again, someone interrupted me and I wasn't really thinking or paying enough attention to what I was doing. So that can be a helpful way to think about being a better monitor, right? Just really thinking about attention is a huge part of memory and seeing if that's playing a role. Another question that can be really helpful to ask is, do hints jog your memory, right? So maybe you forget part of a conversation or something you did last week, but someone gives you a hint or reminds you and it comes right back. Whereas if the hints generally don't help, that would also be a time to think about discussing this with your family or your doctor. And so I think I'll stop there. I hope this gives you just a little bit of ideas about how to monitor your memory concerns or changes, which might serve as a starting point for discussing these things with your family or your healthcare providers. And lastly, I just would want to say, I would really encourage you to discuss any concerns, even if they're subtle, sooner rather than later with your physicians, because it can be really helpful to get kind of baseline testing, baseline workup, which can allow us to track these things a bit better over time, and also hopefully give you some strategies or things to think about that could help improve kind of day-to-day memory, and also optimize brain health. So I think I will stop there. Thanks so much for listening, and be well.